Hello everyone. In today's episode, we are going to discuss how to reduce fasting blood sugar. Easy steps to manage your fasting levels. A 38-year-old man comes to the clinic, has a very strong family history of diabetes. His father and mother have diabetes. His brother also has diabetes. His sister also has diabetes. So he himself was diagnosed with diabetes about 1.5 to 2 years ago. And from the last 6 months, he is having an issue where his sugar is sometimes controlled and sometimes not. And he tried intermittent fasting, he changed his diet, he exercises, and what is the main issue? The main issue is that his sugar at night is normal, meaning that after his dinner, let's say if we check his sugar, it will be 95-100. It's maybe even 120 milligrams DL. But when he will wake up in the morning, his fasting blood sugar will be 180, 190, maybe even 200 milligrams DL. So how to solve this issue? That's what we are going to discuss in this video. Before we start, please take a moment to subscribe so that you will never miss any update from us. Let's understand this case first. This is a classic example of what we call as dawn phenomenon. It is called as dawn phenomenon, or early morning hyperglycemia. In this condition, the blood sugar level is normal at night after dinner, but it shoots up in the early morning, especially between 4 a.m. to 6 a.m. And then you will see that the blood sugar will come down after your breakfast. The main reason for this is that when a person is sleeping, there is a release of cortisol and growth hormone. And the amount of cortisol released is more compared to the amount of growth hormone. Now, both of these hormones are responsible for raising the blood sugar level, but the main culprit is cortisol because it is released in more amount. Let me explain you this with an example. See, if you have to run a race, you will need energy for that, right? So what will you do? You will take some carbohydrate, and that will give you energy to run that race. Now, what happens inside our body is something similar. When cortisol is released, our body gets prepared for some sort of stress. It thinks that it has to fight with some situation, or it has to run from a bear, tiger, or lion. Because when our ancestors used to sleep at night, they were worried about whether they will get killed by a wild animal or not. Their body used to get prepared for this kind of a situation. And the way our body used to get prepared was by releasing cortisol. And cortisol used to trigger a process called as gluconeogenesis. In this process, the liver releases glucose into the blood, and that gave them energy to run or fight with a wild animal. Now, this process is still present in our body. Even though we don't have wild animals near us, we don't need to run or fight with anyone. But still, this process is present in our body, and that's why when cortisol is released, our sugar shoots up in the morning. Now, if you talk about growth hormone, it is also released, but the amount of growth hormone is less compared to the amount of cortisol, so it does not make that much impact. But it is true that both of these hormones are responsible for this raise in blood sugar in the morning. Now, this is not an uncommon finding. Around 90% patients with type 2 diabetes, especially those who are on insulin, will face this issue sometime or the other. So how to solve this problem? It's not just increasing your insulin dose or changing your medication. It needs a little bit different approach. Let us discuss 4 simple tips that you can use to control your fasting blood sugar in the morning. Tip number 1 is to have dinner at least 2 to 2.5 hours before bedtime. This is very important. See, if you have dinner close to your bedtime, let us say if you're having dinner at 9 o'clock and you're going to bed at 9:30 or 10 o'clock, then there are chances that your blood sugar will shoot up in the morning. So try to finish your dinner at least 2 to 2.5 hours before going to bed. For example, if you are going to bed at 10 o'clock, then try to finish your dinner at 7:30 or 8 o'clock. Tip note 2 is avoid eating anything after dinner. Some people have a habit of eating something after their dinner, like maybe some sweets, or maybe some chips, maybe some bread with butter, or maybe some ice cream. Try to avoid doing that. Don't eat anything after your dinner. Only drink water if you want, but try not to eat anything. And this is very important because eating anything after dinner will increase your blood sugar level. And that might be the reason behind your high blood sugar in the morning. Tip number 3 is do a 10 to 15 minute brisk walk about 30 minutes before sleeping. Brisk walking reduces insulin resistance and helps in controlling the excess glucose in the blood. If you are unable to walk, you can sit in a chair and stretch your legs and hands and just move your body for 10 to 15 minutes. Doing this will help you to reduce your fasting blood sugar in the morning. Tip number 4 is to adjust your diet. Now, you have to understand that the main reason behind this high blood sugar in the morning is that there is a release of cortisol. And cortisol triggers the process called as gluconeogenesis, as a result of which the liver releases glucose into the blood, and that raises your blood sugar level. Now, the only way to prevent this is by reducing the amount of cortisol. And the best way to do that is by having a healthy diet. Now, what kind of things should you avoid in your diet? You should avoid refined carbohydrates, white rice, white bread, pasta, pizza, burger, millet, none of these things. Try to reduce the amount of these things in your diet. Try to replace these with complex carbohydrates like brown rice, whole grain, wheat, etc. Also include plenty of vegetables and salads in your diet. Include salads in every meal, especially leafy green vegetables like spinach, coriander, carrot, cucumber. Also include legumes, nuts, seeds in your diet. These are rich in magnesium. Magnesium helps in lowering the amount of cortisol in the blood. And lastly, avoid junk food and processed food from your diet completely. Now, if you follow all these tips, your fasting blood sugar should come under control. If it doesn't, then maybe your doctor will have to increase your medication or change your diet according to your requirements. So these are some really simple and easy steps that you can follow to lower your fasting blood sugar. Now, let's try to understand what are the causes of this dawn phenomenon or early morning hyperglycemia. The main cause is the release of cortisol in the early morning. The second cause is that you are having some hidden stress, but you are worried about something or you are overthinking. Stress can trigger the release of cortisol. And thirdly, it can also be because of some medication that you are taking. Now, if you want to know about the side effects of these anti-diabetic medicines, click on this video. We have discussed everything about it. If you find this video useful, please hit the like button. If you have any doubts, please comment down below. Share this video with your friends and family members. Thanks for watching. Take care. Bye-bye.
Thanks for watching. Like, comments and share.